Welcome to Healthy Living. I'm Lori Johnson. Thanks for joining us today. Our topic is something so many of us deal with: back pain and tech neck, which is a relatively new condition that a lot of us are suffering from. My guest is Dr. Gbolahan Okubadejo, spine and orthopedic surgeon based in the New York City area. Dr. O, great to see you. Thank you so much for being with us today.
Thanks for having me. It's an honor being with you.
So we hear this term tech neck, and what is tech neck and how prevalent is it?
Tech neck is a relatively new phenomenon that's newly defined given the era that we live in now. We spend a lot of time on our computers, hunched over, putting a lot of stress on our posterior cervical spine, the back of our necks. And that hunching over and the tension that results from that is what we call tech neck.
Does a person know whether they have tech neck, and what are the symptoms?
The first thing you notice is just pain in your neck, pain around your shoulders, fatiguing if you've been on your computer for a while. I think people who are most vulnerable are people who don't have balance in terms of their physical activity, in terms of maintaining strength and flexibility, and spending just a lot of time on their computers, working diligently. It does have consequences if you don't have that balance.
So what is worse? Is it a computer or on your phone?
I think it's a combination. I think we spend a lot of time on our computers. With our phones, it's possible to be in different positions. So I think you have a little more flexibility when it comes to the phone. Well, with the computer, most people are at a desk. They're usually facing down. They're locked in for hours at a time. So I think the computer is a more vulnerable threat when it comes to tech neck as opposed to our phones.
I know that at our office, we have our computer screens at eye level. And that is a lot better than, for example, when I'm at home, I usually put my laptop right there on my desk and I look down. What are some things people can do when it comes to your computer to avoid tech neck?
You mentioned one, which is having your computer at eye level. If you're using a laptop, maybe consider putting bolsters underneath your laptop just to have it a little higher. That way you're being conscientious of your positioning and making sure you're not straining as you put your neck down. A third way is actually something that can help your entire body, which is by using a standing desk where you can actually stand up. That means you're fully aware of trying to be health conscious. You're fully aware of your overall posture, of your overall health, and you're taking a proactive attempt to stand up, have good posture, and have less pain in general as you get through your workday.
So what if somebody is feeling pain in their neck? What should they do?
The first thing is to fully characterize the nature of the pain. So if it's pain that's strictly in the back of your neck, around your shoulders, posteriorly, there's nothing radiating into your arms, then most likely it's primarily muscular. So notice how often you have it. Think about the circumstance that leads to the pain being worse. And if it's truly when you're using your computer and bent over, then try to take breaks to extend your neck, rotate it, try to take some of that tension off. If you have pain that radiates into your hands, more associated symptoms, then it could be something more. And in those situations, you may have to consult your doctor as well.
What are some of the things that a spine surgeon such as yourself can do?
So as a spine surgeon, I ask the relevant questions if you see me. So if your pain is associated with radiation, meaning there's pain that travels down into your arms, into your fingers, perhaps you have weakness in your arms or fingers, then I'll do a full physical exam, make sure you don't have any compromise. Based on what I'm hearing, I may get further imaging. Usually I'll begin with an x-ray, consider getting an MRI. Once I've fully understood your anatomy, then that will then determine the next steps in treatment.
Does tech neck ever go away on its own?
It can, but only if you've made the proper adjustments in your life. So if the pain is resulting from bad positioning, and if you continue in that bad positioning, then it's not going away. But if it's strictly positioning, you recognize it, you make the adjustments, and you're more balanced, then yes, it absolutely can go away.
If you have tech neck, are there any possible long-term consequences from it?
Absolutely. If you keep doing the same thing indefinitely, you keep having that pain, and that pain progresses, it can absolutely become a problem. If you have other anatomic vulnerabilities, so perhaps your canal, where your nerves are in your neck, is not as wide as another person, and you're in this posture. We call this a kyphotic posture, continually, time after time, and you start developing degeneration of the disc in your neck. You can start having compression of the nerves, and that can certainly have long-term consequences.
When you have compression of the nerves, that would be a surgical remedy, right?
Not necessarily. It can potentially be surgical, but if you have nerve compression, we always begin with physical therapy, anti-inflammatories. Some people get better just with that. Some people require pain management as well, where they need injections, maybe acupuncture. If you've gone through all those modalities and your pain is persisting or you have compromise, that's when surgery can come into play.
What about chiropractic to alleviate nerve compression?
Chiropractic can be beneficial if you don't have nerve compromise, meaning if you don't have major sensory deficits or motor deficits, you don't have severe compression of your spinal cord, then chiropractic can be a modality that's useful. But I do think you should have a full evaluation to know where you stand anatomically before diving too deep into chiropractic care.
I have heard some people warn against having chiropractic adjustments on your neck. But it seems to be some people kind of go back and forth about whether or not that's recommended because there might be some sort of a stroke risk increase. What is your opinion about that?
There absolutely can be a stroke risk increase. There have been episodes where patients have had dissection, of the artery in the neck, and they've had various vascular injuries. As a spine surgeon, I'm always concerned that someone may have compression of the spinal cord, underlying compression that maybe they're not even aware of, and then they get adjusted, and then the spinal cord directly gets compromised. That's certainly a concern. So I think it's best to have a full sense of where you are anatomically and health wise before engaging in adjustments. So that's the responsibility of your chiropractor, along with your primary care doctor, perhaps your spine surgeon, to make sure you're cleared to have these adjustments. And if you are going to have adjustments, if you are cleared, I do think there should be a limit in how aggressive these adjustments are. I think in the cervical spine, you just have to take a little more caution. Any abrupt movements, the risk of trauma is just too high.
So when you talk about tech neck, we talked about the laptop, but also with the phone. And I think about the kids these days, they start looking straight down from a very young age. Do you think that we're going to be seeing more when they become adults? We're going to be seeing more of these types of things because the population has been looking straight down at their phones for decades.
Unfortunately, I do believe so. I have a 1-year-old myself, and even before she could start blabbing words, she sees myself and her mom on our phones, and as soon as she could grab our phone, she's grabbing the phone and swiping away. And it's shocking how quickly our kids are picking up on these things. And I wasn't doing that when I was a child. So if she's beginning before she's even 1, imagine how things look when she's 30, 40. So I do think the vulnerability and the odds of having issues are higher now than ever, since technology is more prevalent than it's ever been in our existence.
So when we're looking at our phones, should we try to hold them up at eye level? What are your recommendations for when we're looking at our phones?
That's a little tougher because it's kind of awkward. You just have to be aware of your posture and take breaks, and just try to rotate your neck and alleviate tension when you feel tension. It's more about being mindful, I think, versus having a complete lifestyle adjustment of how you hold your phone, which is something that we do all the time.
Could you just briefly demonstrate some of these stretches for the tech neck?
Yeah, so basically, just kind of, adjust your posture. You want to have your neck in line with your body. You want to rotate your neck just to take tension off. You can even just get up and, move your shoulders and your traps around, just movements that relieve tension. When you're in a posture for prolonged periods of time, bent down, your muscles become very tense, and that has consequences for the ligaments, the joints, and everything else beyond that. So you just want to change the posture, have a sense of relaxation where tension is relieved periodically, and then get back to whatever you're doing. So that resets everything, and your odds of having pain become lower. It's about being mindful and taking breaks. So what I often suggest for people who work in offices is to have a timer. That way, over certain periods of time, your timer goes off, and that's your time to stop take a break, adjust position, reset, relieve tension, and then get back to whatever you're doing. I think just having that fully incorporated into your day can be very, very beneficial.
That is great advice. All right, we're going to take a break and be right back with Dr. Gbolahan Okubadejo, spine and orthopedic surgeon, talking about back pain and tech neck. Stay with us. Welcome back to Healthy Living. We are discussing back pain and tech neck with Dr. Gbolahan Okubadejo, spine and orthopedic surgeon in the New York City area. I loved right before the break how you talked about setting a timer to remind ourselves to get up and walk around and move, because I know I sometimes will look up from my computer and don't realize it's been hours that have gone by and I haven't even realized it. Talk about some other things that we can do, not so much about the tech neck, but about back pain. Back pain is something that has been plaguing us for a long time before computers were invented. Back pain is just something so many of us suffer from. How can we avoid it?
The best way to avoid back pain is by being healthier, being conscientious about our routines. The best thing that helps our spine is core strength. So if you have a routine where you're consistently strengthening your core, where you're stretching, where you're actively working to be stronger around your back, around your core, around your abdomen, I think that's the best way to guard against back pain. Ultimately, in addition to being strong and more flexible, BMI is a huge factor as well. So, because the greater your BMI is beyond kind of the recommended weight, which is 30 is kind of an acceptable BMI. Beyond that is when it gets questionable. The further away you are from that, the greater your likelihood of having back pain is. So having your weight controlled, having good core strength protects the back and will ultimately have you feeling better.
What do you feel is the best way to lose weight? I mean, a lot of people's doctors are like, hey, your back would feel better if you lost weight, but that's not so easy to do. What type of diet do you recommend to help people lose weight?
The biggest culprit when it comes to weight gain is actually sugar. So things that have sugar, things that have carb. If you're too aggressive in terms of your sugar consumption, that I think that can certainly be a major contributor. So just be aware of your dietary patterns and try to be aware. How often are you having meals? How often are you snacking? What are ways that you can cut out unnecessary carbohydrates and sugar throughout the day? That's where you begin. But you also have to have a consistent workout routine. A lot of people say that they don't have time, so you have to sacrifice something. So perhaps that's sacrificing a little bit of sleep, getting up a little earlier each day, put in some time, even if it's just half an hour, 3-4 days a week. I think that's cumulative and can make a big difference in how you look and feel.
And you were talking before about the importance of movement, but a lot of times when folks have back pain, that's the last thing they want to do. I mean, what do you do when you're in active pain? Should you move, or because it feels a lot better to just sit down and rest?
Yeah, sitting down only makes things worse. So if you're having active back pain that you find debilitating enough where you feel that you don't want to move at all, see your spine specialist, get evaluated, understand what's happening anatomically, and then we'll come up with a plan. The plans aren't always aggressive. We can begin with something that's passive. Physical therapy, they have different modalities, they have massage, they have things they can do to make you feel better, and then gradually ramp up into getting stronger and feeling better. So first, get a diagnosis, and then once you have the diagnosis, then your doctor, along with your therapist, can come up with a plan to have you feeling better.
We hear this term sciatica and folks struggling with sciatica. What is that?
Sciatica is radiation of pain down the back of your leg. The sciatic nerve is the nerve that's typically the culprit, and that's why it's called sciatica. But any description of pain that travels from the back down the back of our legs, shooting down, that's what sciatica is.
It's very painful, isn't it?
Absolutely, it can be debilitating depending on what the cause is. So if you're having sciatica, it's limiting your quality of life. Get evaluated, have the diagnosis as to what's happening. If it's something anatomic, then we'll come up with a plan for you. Physical therapy, perhaps injections. None of that works. Perhaps you need surgery. Sometimes it's strictly inflammation, and we can come up with a plan alternatively. So the most important thing is to have a diagnosis, and then we'll come up with a good plan for you.
And what are the main ways to avoid sciatica?
The ways to avoid sciatica are the same ways to avoid back pain, which is healthier living, being aware of trying to have a stronger core, being more flexible, being active. That's probably the number one way to avoid sciatica. The other thing that I should mention is some people are trying to do the right thing by being active. However, their activities can be injurious. Specifically, if you're in the gym and your form is bad, meaning you're doing deadlifts and the weight's too far ahead of your body, it's out of balance. You're putting a lot of stress on your disc that can lead to injury on sciatica. Or if you're doing squats, a lot of people do squats. They squat with bad form or with more weight than is necessary. That can absolutely be a major cause of pain. The last thing I'll say is some people do not adjust their routine with age, which is something I'll be delving into further over time. Is as you get older, your body's changing, and has your workout routine also changed with your body. And if you haven't given thought to that, then your risk of injury becomes higher.
All right, we need a reality check when it comes to aging. All right, we'll be right back with Dr. Gbolahan Okubadejo, spine and orthopedic surgeon, talking about back pain and tech neck. Stay with us. Welcome back. We're talking about how to avoid back pain with spine surgeon Dr. Gbolahan Okubadejo. So right before the break, you were talking about how we need to protect our backs when we're at the gym. You were talking about doing squats the wrong way and deadlifts the wrong way. You don't want your knees to go further forward than your toes, right?
There's a biomechanical diagram that shows that the further the weight is away from your body, the fulcrum, the resulting fulcrum puts more stress on your back, which leads to injury at a higher rate. So you need the weights closer to your body whenever you're exerting. That way the axial force doesn't cause injury because you're creating a moment arm that can put too much stress on the disc. So things have to be closer to your body, and that way you're being safer. And also monitor how much you're lifting. You don't have to overly strain to get gains. It's about form, it's about reps, more so than the amount of weight, especially as you get older.
And as you talk about getting older, we've been told so many times that lifting weights is so good for preventing osteoporosis for all of us, especially women. So we should continue to lift weights, but maybe seek advice from a trainer as we get older?
There are two parts to that question that you asked me. So yes, having resistance training as you get older is absolutely critical because it helps our bone density and helps us have better bone as we age. But also as we get older, there's a natural tendency to lose bone density once you cross beyond a certain threshold. So your vulnerability to injury becomes higher. So lift the weights as you get older. And then once you get into a certain point, then focus more on reps versus going higher and higher in weight because you don't want your vulnerability to injury to increase too high where you're causing yourself injury.
What about mattresses? Does your mattress make a difference when it comes to back pain?
It makes a big difference. The mattresses that have been proven to be most supportive to prevent back pain are mattresses that are firmer. Because when a mattress is firmer, your body has a little more support and there's less risk of having unnecessary contours that can lead to back pain. Mattresses that are softer, where you sink in, have a higher risk of causing pain. So lean more towards firmer versus softer when it comes to your mattress top.
We heard about sciatica. What about a herniated disc? What is that? We hear about that a lot.
Yes. So a herniated disc is when a disc protrudes beyond the safe margin within the spinal canal, causing nerve compression. And it can come at different sizes. And the bigger the herniated disc, the more likely it causes pain, and the more likely you need a professional to help you get out of pain.
So we go see your doctor if you're having that. All right, yeah. We'll be taking one final break and be right back with spine surgeon Dr. Gbolahan Okubadejo right after these messages. Welcome back to Healthy Living. We are talking about how to prevent back pain and tech neck, and if you start having issues in these areas, what to do about it. My guest is Dr. Gbolahan Okubadejo, spine and orthopedic surgeon based in the New York City area. Unfortunately, Dr. O, we only were able to scratch the surface on this issue that so many people are dealing with. Where can folks find out more about you?
You can come to my website, nynjspine.com. I have offices in both New York and New Jersey, and my staff is waiting patiently, and we'd love to have you guys come in and see us. Multiple websites. We have Spine Doc NYNJ on Instagram, Spine Core Doc on Instagram as well. We have my fitness page, which is 360corefitness.com. 360 Core Board is a fitness product that I also have to strengthen the core. So log in and find us, and you'll see a treasure trove of information of how to get your core stronger and healthier spine overall.
Well, for many, many years, we were told, smoking is the greatest health hazard. But now there's this new phrase that people say sitting is the new smoking. It's that bad for you. Do you agree with that?
Absolutely. Sitting and being inactive, major culprit when it comes to back pain. And as we stated earlier, technology almost forces us to sit down more than we ever did in the past. So the rates of back pain and just being less healthy are potentially higher. So we have to be very mindful and very proactive in being healthy when it comes to our bodies and our spine in general.
If you had to say one thing to help people prevent back pain, what would it be?
Keep your core strong. The stronger the core, the more protected your back is, the better you'll feel. So think about your core and being strong and flexible, and you'll definitely feel better.
Is there any harm in you were talking about some weights that were problematic, weight exercises when done improperly. What about riding a stationary bike?
A stationary bike is excellent because it gets you moving, but also just be aware when it comes to posture, even on like you don't want to be bent over too much, right?
Right.
So you want to have good posture and keep moving and be active, but you can't bike only. You have to couple biking with other activities to keep your core strong. So
Mix it up a little.
yeah, it has to be balanced.
All
Absolutely.
right. Well, Dr. O, thank you so much for your expertise and for being with us today on Healthy Living. We so appreciate it.
Thank you.
And thanks to you for joining us for this edition of Healthy Living. I'm Lori Johnson, and we'll see you again next week.